Welcome to Renus Care Radio, a podcast dedicated to topics of interest to the kidney care professionals. Hemolytic Uremic Syndrome, or HUS, is a rare but serious medical condition that typically involves three main features: hemolytic anemia, a low platelet count, and acute kidney injury. While the kidneys are most affected, other organs can also be involved. HUS occurs more commonly in children, but it can affect adults as well. This episode will explore the cause, types, clinical signs, diagnosis, and treatment of HUS. HUS begins with damage to the inner lining of small blood vessels, particularly in the kidneys. This damage causes small blood clots to form, which block blood flow and lead to reduced oxygen and nutrient supply to the kidneys. As red blood cells move through these clotted vessels, they become damaged, which leads to their destruction, a process known as hemolysis. This results in anemia, meaning there are fewer red blood cells to carry oxygen throughout the body. Meanwhile, platelets, which help the blood to clot, are used up as the body forms these small clots, leading to a drop in platelet numbers, or thrombocytopenia. These processes together cause acute kidney injury, where the kidneys are unable to filter waste effectively. In severe cases, other organs like the brain, heart, and digestive system may also be affected. There are three main types of HUS. The first is caused by a bacterial infection, usually from eating contaminated food. This infection is caused by Shiga toxin-producing bacteria, most commonly E. coli. The toxin from this bacteria enters the bloodstream and damages the blood vessels, which leads to the symptoms of HUS. This type is most common in children. A second form is called atypical HUS, which results from an abnormality in the body's immune system. In this case, a part of the immune system called the complement pathway, which helps fight infections, is overactive. This overactivity causes damage to the inner lining of blood vessels, leading to the formation of clots. This type is less common and can be genetic. Atypical HUS tends to occur repeatedly and can be more serious than the type caused by infection. A third form is secondary HUS, which occurs as a result of other conditions, such as cancer, autoimmune diseases, infections, or reactions to certain medications. The underlying mechanism varies depending on the specific cause, but the end result is the same: damage to the blood vessels, formation of clots, and the triad of hemolysis, low platelets, and kidney injury. People with HUS typically experience signs related to these three issues. Hemolytic anemia leads to symptoms such as fatigue, pale skin, and sometimes yellowing of the skin or eyes. The low platelet count can cause easy bruising, small red or purple spots on the skin, or other signs of bleeding. The most serious problem is kidney damage, which can cause symptoms like decreased urine output, swelling, and high blood pressure. In more severe cases, neurological problems, including confusion, seizures, or even strokes, may occur. Digestive symptoms, such as stomach pain, vomiting, and diarrhea, are particularly common in the type caused by infection. To diagnose HUS, doctors rely on a combination of patient history, physical examination, and lab tests. Blood tests typically reveal low red blood cell counts, elevated markers of red blood cell destruction, and low platelet counts. Tests of kidney function often show high levels of waste products in the blood and other signs of kidney injury. In cases suspected to be caused by infection, stool samples may be tested for the presence of the Shiga toxin-producing bacteria. If atypical HUS is suspected, doctors may also test the patient's complement system to look for abnormalities. Treatment for HUS depends on the underlying cause and the severity of symptoms. In many cases, the main focus is on supportive care. This includes managing fluid and electrolyte balance, especially if the kidneys are not functioning properly. In severe cases where the kidneys stop working altogether, temporary dialysis may be necessary to remove waste from the blood. Blood transfusions may be required for severe anemia. Antibiotics are generally avoided in the form caused by infection, as they can sometimes worsen the release of toxins from the bacteria. Instead, treatment is focused on managing symptoms and monitoring kidney function. For patients with atypical HUS, newer treatments have become available, particularly a drug called eculizumab, which works by blocking part of the complement system. This treatment can prevent further damage to blood vessels and reduce the risk of long-term kidney damage or failure. In secondary HUS, treatment involves addressing the underlying condition, whether that is stopping a medication or treating a specific disease. The outlook for people with HUS varies depending on the cause, age, and the speed at which treatment is started. Children with HUS caused by infection generally have a good outcome, with most recovering full kidney function. However, some may go on to develop long-term complications, such as high blood pressure or chronic kidney disease. Atypical HUS tends to have a worse outcome due to its recurrent nature and higher likelihood of leading to permanent kidney damage. However, early diagnosis and the use of complement-blocking drugs have greatly improved the prognosis for patients with this form of HUS. In conclusion, hemolytic uremic syndrome is a serious condition that affects the blood and kidneys. Although it is most commonly caused by bacterial infection in children, it can also be caused by genetic and secondary factors in adults. Early diagnosis and proper treatment are critical to improving outcomes, and recent advances in drug therapy offer hope for better long-term management, particularly for patients with atypical forms of the condition. Thank you again for joining us here on Rennis Care Radio.